Is fat embolism a risk of BBL plastic surgery? When considering a Brazilian butt lift, or BBL, many people wonder about the risks involved, particularly the risk of fat embolism. Fat embolism is a serious complication that can occur during this procedure. It happens when fat particles enter the bloodstream and block blood vessels, leading to potentially life-threatening issues, such as pulmonary fat embolism, where fat blocks vessels in the lungs. This complication is noted as the leading cause of death related to BBL surgeries. During a BBL, fat is typically harvested from areas like the abdomen, hips, or thighs, and then injected into the buttocks to enhance their shape. The risk of fat embolism primarily arises when fat is mistakenly injected into or beneath the gluteal muscles instead of strictly into the subcutaneous fat layer, which is just under the skin. When fat is injected into the muscle, it can enter large veins, allowing it to travel to critical organs like the lungs, brain, or heart, causing severe blockages. Research indicates that fat embolism is the most serious complication of BBL surgery. Historically, mortality rates have been reported as high as 1 in 3,000 cases, making BBL one of the more dangerous cosmetic procedures. However, when performed by board-certified plastic surgeons in accredited facilities using safe techniques, the fatality rate can drop significantly to less than 1 in 15,000 cases. To minimize the risk of fat embolism, modern surgical protocols focus on several key practices. These include injecting fat only into the subcutaneous space and avoiding deep muscle layers. Surgeons may also use ultrasound guidance during fat injection to visualize the anatomy in real time, which helps prevent unintentional deep injections. Choosing qualified, experienced surgeons and accredited surgical centers is crucial for ensuring adherence to safety standards. Despite these precautions, fat embolism remains a critical risk inherent to the BBL procedure. It is essential for patients to be fully informed about this risk and to seek out surgeons who follow the latest safety guidelines. Careful attention to surgical technique and patient selection is vital for minimizing the chance of fat embolism and improving overall outcomes. Other potential risks associated with BBL include infection, bleeding, scarring, asymmetry, nerve injury, and dissatisfaction with aesthetic results. However, fat embolism is recognized as the most severe and potentially fatal complication. In conclusion, while fat embolism is a serious risk of Brazilian butt lift surgery due to the nature of fat grafting in the buttocks, advancements in surgical techniques and strict adherence to safety protocols can help reduce, but not completely eliminate, this risk. Always consult with healthcare professionals to discuss individual risks and safety measures before undergoing any procedure.